Welcome, I am Terry Tropin, and today I'll be discussing notes you can make in your ICD-10-PCS books. But first, let me start out with information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I am also an AHIMA-approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I've also written some books on coding. So you see these here. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM coding, ICD-10-PCS coding, and a new one, changes in the CM and PCS code books for 2024. These are all available now. The E&M book will be available for the 2024 version of the E&M book will be available shortly, I hope. If you would like a copy of the slides for this video, like the video and send me an email. I will send you a PDF of the slides. So here's an overview of this presentation. First of all, why would you make notes in your book? Okay, and then we're going to go into specific notes from the index, discussing overlapping terms, alphabetizing confusion, and endoscopy procedures. And then notes for the medical and surgical tables, right on the table itself, bypass procedures, transfer procedures, and then other notes for specific body systems. And then I'm going to talk a little bit about notes for other tables in surgical section, the surgical, other surgical sections. So we have notes for specific body systems and notes for other sections. Okay, let's start with the PCS index. Now, some of the main terms are overlapping. So for instance, there's a main term for change device in and also change device in or on. There's main term insertion and a main term insertion of device in. Removal and removal of device in, and revision, separate revision of device in. So this can be confusing, so I suggest you just highlight or underline these changes, and that way you'll be able, if you underline or highlight it, it'll catch your eye. The point of this whole thing is to catch your eye. Oh yeah, there's not resection, there's also, there's not just revision, there's also revision of device. So that way you see both of them. Now here's some more examples of these terms. There's replacement, and there's a separate main term for replacement hip, and a separate main term for replacement knee. For resection, there's resection by itself, and then resection left ventricular outflow tract obstruction, and resection subaortic membrane. So underline these, highlight these, and this will help you keep them straight. So you don't go to resection and go, well, where is subaortic membrane? Well, that has its own main term, and if you have that underlined or highlighted, you will find it much easier. So there's also some issues with alphabetizing. So in some entries, you have entries that have subterms for arm, leg, and wrist. In other entries, main terms, you have upper arm, lower leg, upper leg, not just arm by itself. So I would suggest that you underline these, or do an arrow or something to show you that it's not under arm, it's under lower arm and upper arm. Now, where are you going to find these? Well, you're going to find them in under these main terms. Destruction is the main term, and the subterms for muscle, skin, subcutaneous tissue, and fascia and tendon. Under division, same subterms. Drainage, same subterms. Extirpation, same subterms. Extraction, same subterms. Now you may want to stop this video periodically so you can get all of these down and write them in your book, or you can just send me an email and I'll send you a copy of the slides. Either way, whatever works for you. Okay, endoscopy procedures are somewhat tricky. You see in there EGD, esophagogastroscopy, gastroduodenoscopy, gastroscopy, ileoscopy, rhinoscopy, salpingoscopy, sigmoidoscopy, ureteroscopy, urethrooscopy, vaginoscopy. Now, sometimes they have all 7 digits under this. So you look up EGD, you see 7 digits, you go, great, I'm done. But you're not. The code that they give you, they'll give you either 6 digits or 7 digits, are for an inspection using these, not the whole code. So if you have an EGD with a biopsy, the code written in the index under EGD is incorrect. In most cases, the endoscopy procedure is the approach used. Use the root operation for the point of the operation, drainage, destruction, dilation, whatever. The endoscopy is the approach value. Percutaneous endoscopic via natural or artificial open endoscopy, via natural artificial opening with percutaneous endoscopic assistance. So be careful. I saw this with my students all the time. They go, great, I'm done. And they just write down that code and move on to the next question. But that is often incorrect. So find these terms in the index and write in inspection only next to each one of them. Now let's look at the tables. That's all the ones we have for the index. Let's look at the tables. So notes in the tables under bypass procedure. Write in character 4 equals bypassed from, character 7 is bypassed to. Now this bypass is in these body systems: nervous, heart and great vessels, upper arteries, lower veins, gastrointestinal, hepatobiliary, urinary, female reproductive, male reproductive, anatomical regions general. And you're thinking, wow, that's a lot of hassle to do this. But if you're trying to find a code and you're taking a test or taking a certification exam, you want to make this as quick and easy as possible. And this will remind you which each one that you have, that character 4 is from, character 7 is to. So here's some more things to write in on those same, while you're there, writing in the other thing, the to and from. You can also write in, use different codes if different devices are used. So if that device digit is different, you're going to use different codes. Use additional code if graft is harvested at same surgical site, and do not code separately for anastomosis. Now you may know this. If you do, you don't need to write it in. But it's a good thing to have it as a reminder right where you are. So these are for the same systems: nervous, heart and great vessels, upper, lower arteries, lower veins, gastrointestinal, hepatobiliary, urinary, female and male, and anatomical regions general. So that's for bypass. There's also some notes you can make into these 4 tables for transfer procedures. That's procedure X. In these systems, write in character 4, transfer from, character 7, transfer to. Again, you may know this already. If not, it's not a bad idea to write in a reminder. So this is nervous, table 00X and 01X, gastrointestinal, male reproductive, and anatomical regions. So those are the general bypass and transfer, general for all of the different body systems. I also have some notes you can make for specific body systems. For example, the nervous system, that's 01 and 00. So for table 00H and 01H, which is insertion, write in stimulator, code also from table 0JH. And this is insertion of subcutaneous tissue. So we're doing the insertion of the stimulator, and you're doing it in 2 parts. So you're also doing subcutaneous tissue and fascia for this. Also for the central nervous system, the root operation drainage, write in lumbar puncture to diagnose condition, use qualifier X. Lumbar puncture to treat condition, use qualifier Z. So let's move on to heart and great vessels. So for heart and great vessels, body system 02, at the beginning of this section, what has like the summary of the procedures of the digits, write in great vessels equals superior and inferior vena cava, pulmonary artery, pulmonary vein, coronary artery, coronary vein, pulmonary trunk, and thoracic artery. Also write in if cardiopulmonary bypass performed during heart surgery, code also 5A1221Z. Okay, so that's another thing that's often missed. You don't want to miss anything. So the cardiopulmonary bypass is coded separately. Also write in if more than one device is used, code separately for each. Also for heart and great vessels, under table 02H insertion, write in code also for insertion of generator, 0JH insertion subcutaneous tissue and fascia. Very much like the one we just saw. Okay, the final note for this body system is in the table for removal. So write in at table 02P, removal, if pacemaker or implantable cardioverter defibrillator removed and replaced during the same surgical session, code for both removal under P and insertion under H. Okay, let's move on to upper arteries. So at the very beginning of this section, when they have the listing of all the possible characters within this system, write upper arteries are above the diaphragm, and also write in procedure on a continuous part of a blood vessel, use body part value for site closest to heart. This is an important guideline and it was changed recently. So body part closest to heart. Okay, let's look at lower body system. So at the beginning of this section, write in lower arteries are below the diaphragm. Okay. Also write in the note about the continuous blood vessel. Use body part value for a site closest to heart. Okay, let's look at upper veins. Body system 05. At the beginning of the section, upper veins above the diaphragm, procedures on a continuous part of blood vessel, site closest to heart. Those same notes again. So this just clarifies it. And yes, this is a lot of work to write all this stuff in, but trust me, if you do it, you will be glad that you did. So let's look at lower veins, body system 06. Write in lower veins below the diaphragm, procedure on a continuous body part, site closest to the heart. So this reminds you, you don't have to think about it. It's like right there in front of you. You don't have to think. Okay, let's move on to the lymphatic and hemic system 07. At the beginning of this section, write in cutting out all of a lymph node chain resection. Cutting out part of a lymph node chain is an excision. Sampling of lymph node chains, use an excision with qualifier diagnostic X. Okay. Also write in for transplantation of stem cells, use the administration section 3, not this section, not a transplantation code. The guidelines say this should be under administration. Okay, let's look at ear, nose, and sinus, body system 09. At the beginning of this section, when all the list of possible values are, write in this system overlaps with respiratory and mouth and throat. Use different codes if different devices or qualifiers are used. Use additional code if graft is harvested at same surgical site. Okay, that's the general notes at the beginning of the section. Then turn to table 09H with insertion. Write in, use this table for insertion of hearing device. For hearing assessment, treatment, device fitting, see section F. So outside this system. Okay, the respiratory body system, 0B. At the beginning of this section, write in, this system overlaps with mouth and throat and ears, nose, and sinus. Also write in, lungs, plural, bronchi includes several different body part values. Each value is considered a separate body part. Use the most specific value available. So if it's right upper, use that instead of the whole body part, the whole lung, for example. You want to be as specific as possible, as specific information that you have. It's kind of a good reminder of that. Okay, mouth and throat, body system 0C. At the beginning of this section, write in, this system overlaps with digestive system, ear, nose, and sinus, and respiratory system. Okay, let's look at the gastrointestinal system. Here are some notes. At the beginning of this section, write in, system overlaps with mouth and throat. Upper intestinal tract, 0, esophagus through upper intestinal tract, esophagus through duodenum, lower intestinal tract, jejunum to anus. Okay, so where does the lower upper start? That's what you want to make notes about. The intestine colon includes several different body part values. Each value is considered a separate body part. Use the most specific available. So don't use just colon if you have more specific information. That's what this is saying. Easy to forget. Okay, let's look at the hepatobiliary and pancreas, the body system 0F. At the beginning of this section, write in, this system overlaps with gastrointestinal and endocrine. Also write in for insulin administration, see table 3E0 with qualifier G. So this is taking you to the administration section. So also in hepatobiliary and pancreas, look at table 0FH, insertion. Write in for insertion or removal of insulin infusion pump, use code from subcutaneous tissue and fascia, J. Tables OFC and OFF, extirpation and fragmentation, write in extirpation, calculi broken up and removed, fragmentation, calculi broken up but not removed. I know this isn't the definition of these terms listed at the table, but they're often confused. If you get these confused, write this in and you'll be good. Also at table OFY, transplantation, write in transplantation of pancreatic islet cells, use code 3E0. So that's into the administration section again. It's different. It's not coded as a transplantation, even though it says transplantation, right? So now we're looking at the endocrine system. So at the beginning of this section, write in, this system overlaps with the hepatobiliary system. And again, we have those partial organs. The adrenal gland, thyroid gland, parathyroid gland includes several different body part values for upper, lower, right, left, that kind of thing. Each value is considered a separate body part. Use most specific value available. Okay. Skin and breast. So at the beginning of this section, write in, list a code for the deepest layer only involved in a procedure. And these other ones are really important. These are in the guidelines. So shoulder is listed as upper arm, elbow is listed as lower arm, wrist is listed as lower arm. There's not a specific value for shoulder, elbow, wrist. You use lower arm, upper arm, etc. For hip is upper leg, knee is lower leg, ankle is foot. So that's in the guidelines, but if you write it in at the beginning of this section, you'll be good. So for specific values within this section, skin and breast, look at 0HH, insertion for breast reconstruction, write in, code also for breast reconstruction 0HQ or 0HR. For OHB, excision. For debridement, write in, used for excisional debridement. OHD, extraction, used for non-excisional debridement. So these are tricky. So it's always good if it's tricky, write it in. If you find something that you get confused about that's not on these slides, write it in. Don't drive yourself crazy trying to remember stuff, because you can't. Who can remember all this stuff? So write it in, and next time it'll be right there where you want it. So let's look at subcutaneous tissue and fascia, 0J. At the beginning of the section, we're going to write those in again. Procedures performed overlapping tissues, list a code for deepest layer, and we're also going to write in the definitions of shoulder, elbow, wrist, hip, knee, ankle. Okay. So on table 0JX, transfer, write in body part value, deepest tissue, qualifier value, intervening layers for pedicle graft or flap. So write that in so that you remember it, because that's also something that's fairly confusing. Okay, let's look at the muscles body system, 0K. At the beginning of this section, write in procedures involving tissue that supports a joint, list a code for body system that is primary focus of the procedure. So if it's primarily on the joint, use a code for joint. If it's primary on the muscle, use a code for muscle. If the procedure is performed on overlapping layers of tissue, list a code for deepest layer. I know this sounds repetitive, but each table should stand by itself if at all possible. So here are some specific tables under muscles, body system 0K. 0KX, transfer, body system value, deepest layer of tissue, qualifier value, other tissue layers being transferred. Table 0KB, excision, write in, used for excisional debridement. 0KD, extraction, used for non-excisional debridement. So let's move on to tendons, body system 0L. At beginning of this section, write in, if a procedure is performed in overlapping tissues, list code for deepest layer only. For procedures involving tissue that supports a joint, list a code for the body system that is primary focus of the procedure. If it's tendon supporting a joint, use a tendon. If it's a joint, use a code from the joint section. And again, table 0MB, excision, for excisional debridement. 0MD, extraction, non-excisional debridement. So let's move on to bursa and ligaments, body system 0M. So at the beginning of this section, again, write in the thing about tissue supports a joint. So what is the primary focus of the procedure? The bursa or the joint? Ligament or the joint? Again, a note about overlapping layers of tissue, use deepest tissue only, and upper bursa and ligaments are above the diaphragm, lower bursa and ligament are below the diaphragm. And again, we're going to talk about excisional or non-excisional debridement, OMB for excisional debridement, OMD for non-excisional debridement. Okay, and the head and facial bones, body system 0N. So under, we're doing again the thing about, this is different. ONB, excision, write in, if robotic assisted surgery used, code also 8E09, and then additional digits. For table ONH, which is an insertion, code also for insertion of generator, OJH. Easy to forget to use these additional codes, and you certainly don't want to do that. So here are some notes for the upper body system. At beginning of the section 0P, write in upper bones above the diaphragm. Includes cervical and thoracic vertebrae. For table OPS, write in used for displaced fracture treatment, used for dislocation without fracture, and use separate code for insertion of device. Okay, lower bones, body system 0Q. At the beginning, write in lower bones below the diaphragm and includes lumbar vertebrae. So in table 0QS, write in used for displaced fracture treatment, dislocation without fracture, separate code for insertion of device. And you also want to write in for transplantation of bone marrow, use code for administration section 3. The documentation will say transplantation, but that's not how it's coded. So let's look at upper joints, body system 0R. At beginning of section OR, write in upper joints are above the diaphragm, and then the note again about tissue that supports a joint. Primary focus. Okay, also in table 0RS, write in used for displaced fracture treatment, dislocation without fracture, treatment of displaced joint, separate code for insertion of device. So as I said, a lot of this is repetitive, but you want to have it right there at that section. You don't want to have to look it up in the guidelines to find out what was that. You want to have it right there for you, ready to go. So here's the lower joints, body system 0S. Lower joints below the diaphragm. Note about overlapping tissues, and note about tissues supporting a joint. So write those in at this too. Okay, so let's go on to the urinary system, 0T. At the beginning of this section, write in hemodialysis, see table 5A1, peritoneal dialysis, see table 3E1M9. So you might be in the urinary system and then go, I need to do your dialysis, and this will tell you right away which ones you use. Also, that note about extirpation versus fragmentation, write that in at 0TC and 0TF. Extirpation, broken up and removed. Fragmentation, broken up but not removed. Not surgically removed. Okay, female reproductive system. For procedures on products of conception, see section 10. So remember, female reproductive system is for non-pregnant patients generally, or procedures that are not on the products of conceptions, the fetus, the amnion, umbilical cord, whatever. Those are ported to obstetrics. Other things, even if the patient is pregnant, you're doing something on the cervix, you'll put in this one. The question to ask is, did she have this structure before she got pregnant? Yes, she had a cervix before she got pregnant. So therefore, you're going to use the female reproductive system, not the obstetric system, even if she is pregnant. So turn to table 0HH and write in contraceptive implant into subcutaneous tissue, use 0HH. And then write in IUD code to this table. So let's look at the male reproductive system. Lots of different things here. Write in TERP with approach 7. See also table 0VB. So 0VT, 0VB, depending. And then also write for robotic assisted endoscopic prostatectomy, use 8E0W4CZ. There's a lot of stuff on the prostate, so here we go. Table 0VB, excision, write in TERP with approach 7. For robotic assisted endoscopic prostatectomy, see also 8E0W4CZ. For under table 0V5, destruction, write in TUMTI with approach value 7, tuna with approach value 7, tulip with approach value 8 plus BB4 and the rest of the code. For imaging, for VLAP, use 0V5 with approach value 8. So lots of different things for prostate surgery, and you want to try to keep them clear. Okay, anatomical regions. At beginning of the table, write in includes body areas, systems, and cavities. So for anatomic regions, upper extremities, 0X. At the beginning of table, write in includes body regions, upper and lower arms, wrists, hands, and forequarter. Under table 0X6, detachment, write in raise equals hand bones reaching into fingers. Bone 1 is the thumb, and then you count 2, 3, 4, 5. 5 is the pinky finger, because all it says is 1, 2, 3, 4, 5. So that way you keep it straight. Okay, for lower extremities, at the beginning of the table 0Y, write in includes buttocks, inguinal, femoral, knee, and ankle regions, upper and lower legs, foot and toes, and hindquarter. So for 0Y6, detachment, right in, raise equals foot bone, reaching into toes. Big toe is 1, count over to the baby toe, and that is 5. So that'll tell you which number you are at. So that's all for the surgical section. Let's look at the other sections. First, in the obstetrics section. At the beginning of the section, write in what I had said previously, structure present before pregnancy, use code for medical and surgical section, structure developed because of pregnancy, the fetus, the amniotic sac, the umbilical cord, use code from the obstetrics section. So did she have this before she got pregnant? That's the operative question. Now, it seems to be like the root operations don't really fit neatly into the obstetrics section. So what I did is I wrote in at the tables what it covered. For example, 101, fetal monitoring device removed and replaced. 102, amniocentesis, or artificial rupture of membranes. 108, transvaginal abortion using vacuum aspiration. 10D, cesarean, forceps, or vacuum delivery. 10E, manual assisted vaginal delivery or spontaneous abortion. 10H, insertion fetal monitoring device. 10P, removal fetal monitoring device without replacement. 10Q, repair fetus or other products of conception. 10S, cephalic version. 10T, treatment of ectopic pregnancy. 10Y, transplant of fetus or other products of conceptions. It seems to me like trying to go to the index to look up these is more confusing. And since obstetrics is only a couple of pages, I would write this in and then you can go straight to the obstetrics section and look at it there. Seems to me to be more efficient. Now, you may not agree, and that's fine. So let's move on to the non-surgical section, other than obstetrics. Administration, section 3, write-in used for transplantation of bone marrow, stem cells, pancreatic islet cells. And also use body system value identifying where the substance is administered, not site where the substance will take place. So if you administer something into an artery and it's supposed to work on the pancreas, the body system value is the artery, not the pancreas. For measurement and monitoring, section 4, just write in measurement 0 is 1 reading, monitoring, measurement 0, 1 reading, monitoring 1, more than 1 reading over time, just to kind of clarify this. Okay, other procedures. Now, some method values, character 6, and other procedures, section 8, are used to build add-on codes. So these are used in addition to the surgical code. So write in, these are add-on codes. Computer-assisted procedure, B. Robotic-assisted procedure, C. Near-infrared spectroscopy, D. And fluorescent-guided procedures, E. So write in that these are add-on codes. These don't stand by themselves. They're added on to a surgical code. You want to be sure a surgical code, you use these also. Okay, so that's what we have here. I hope these notes will help you find the correct code easier and more quickly. And if you find something else that you find confusing that's not among these, write it in your book. You will be able to find it later and be much, much easier. So again, these are the books that I have written. The E&M book should be out shortly. The CM book for 2024 and the CM and the PCS book for 2024 are out. I've also written a book that takes just the changes for the CM book and the PCS book and put that in a separate book. These books here take the changes plus other information about to help you code. So it's more a summary of all the coding guidelines, including the new ones for 2024. This final book is just the changes. So if you want to contact me with comments or questions, here's my Facebook page, here's my email. If you want to want a copy of these slides, give me a thanks and send me an email to terry.tropin@gmail.com, and I will send you a PDF. These are updated. My books are updated every year or as needed, and so you should have the most current information. Thank you so much for listening. I hope this was helpful. Thank you.